The single-subject experimental research design became popular and began around 1950. At this time, it was commonly used in psychology. Researchers wanted to see if specific treatments were effective and worked with patients. In the 1950s, researchers often used case studies. According to Duke and Mallet, researchers were interested in finding a design that could establish a causal relationship. This means that they needed research where one variable causes, influences, or affects another variable. The single-subject research design was one way to do this. There are many reasons why people use single-subject research. First, it can help researchers understand if an academic intervention is effective or not effective. One example Duke and Mallet mentioned on page 386 was how rereading a passage affects a student's reading comprehension. According to Del Siegel at the University of Connecticut, the single-subject research is also helpful when someone is interested in changing the behavior of an individual or seeing if a behavior intervention is effective. In both of these situations, the researcher would implement an intervention or treatment, collect data, analyze the results, and determine if the specific strategy or intervention was effective. Next, this method is also popular because researchers have started to combine it with other research methods. This will help them explain and analyze their results better. It will also help them understand how the variables affected the individuals and the effects that their interventions or treatments had. Finally, there are a couple reasons why this method is popular and might be used instead of other research methods. First, it might be difficult to find a large group of people who are able, interested, or willing to participate in a research study. The single-subject method only requires one person or a very small group of people, and this might be easier for researchers to find. Next, it can sometimes be difficult to compare data between groups. The single-subject research method is popular and useful because it analyzes the data from one person. According to Duke and Mallet, this is also beneficial because each person is part of the control variable. Finally, the single-subject research method can be used to see how different people respond to the same intervention or treatment. For example, some individuals might respond positively to some interventions, and other individuals might not respond as well to the exact same intervention. There are many reasons why the single-subject research method is useful. There are two main theoretical frameworks for the single-subject research design method. The first theory is the behavior theory. This theory is important because one of the purposes of this research method is to provide interventions or treatments to change a specific behavior in individuals. For example, Plano, Clark, and Cresswell described an example of helping students with selective mutism. In this situation, the researchers would provide an intervention related to helping the students respond verbally, monitor the intervention, and evaluate if it was effective or helped the individuals. A second important theory is the cognitive theory. This is important because the single-study research method can target specific academic needs, and it is also sometimes used to evaluate people's response to reading and academic interventions or treatments. Duke and Mallet provided an example of an intervention for reading comprehension. In their example, one intervention could be thinking aloud and graphing how many facts or details an individual remembered. Similar to the behavior theory, the researchers would also monitor the intervention and evaluate if it was effective and helped the individuals. The single-study research method can be related to the behavior and cognitive theories because this research method is used in psychology and in education. Similar to what I mentioned earlier, in the past, the single-subject research method was commonly used in psychology, clinical settings, and with patients. According to Duke and Mallet, it focused on the therapeutic value of an intervention. This has changed slightly because now single-subject research is common in the areas of literacy, education, and psychology. This research method influences studies where treatments or interventions can be implemented in a single session instead of over a couple days, weeks, or months. For example, in reading and education, this might mean that researchers would analyze how using graphic organizers during or after reading a story affects a student's reading comprehension. It would not be as beneficial to analyze how effective a spelling or reading curriculum is because this usually cannot be completed in one session.
The following is a research article that was conducted using single subject research design. The article is about research regarding reading fluency. The title of this article is Increasing Reading Fluency Using Read Naturally with 2 third-grade students with specific learning disabilities, a replication of Erikson. The authors of this article are Sarah Morgan, T.F. McLaughlin, Kimberly Wiebe, and Barbara Bolich. The Read Naturally program is a commercial reading program that focuses on using common words that students would know. It also focuses on using repeated readings with the students. In the Read Naturally program, the students have a cold read, which is reading without a familiar story. They are timed on that reading for a baseline. After that, they read with the CD player, which is reading the story. They read that 2 times with the CD player. Then they read independently. After they've read the story independently, they go back to reading with the CD player, and then they return to reading independently, after which they decide if they are ready to try to make their reading fluency goal. The reason for this research is that reading fluency is essential. Fluency is the road between word recognition and comprehension. Without reading fluency, comprehension is usually a struggle for students. This research is not the first research that was conducted. The initial research happened in 2006. It was an 8-week-long research program where students worked 30 minutes daily using the Read Naturally program. This research involved teacher modeling, repeated readings, and progress monitoring. The results of the first research were that fluency improved in the students, and the students' state test scores also improved dramatically. The purpose of the current research is to see the effectiveness with 2 third-grade students with the specific learning disabilities, to see how this program will help them. The methods are a single subject research design. There are 2 participants in this study. The first student is 9 years old. This student has a specific learning disability. However, this learning disability does not have a history in the family. The student receives education through a general education classroom at least 70% of the time, but they also go to a resource room for reading for 60 minutes of their day. This student has tested below average in reading levels, including their DRA levels. Student number 2 is also 9 years old, and this student has a specific learning disability as well. However, this student has a family history of learning disabilities. This student receives 60 minutes of reading instruction in the resource room, as well as general education classroom setting for at least 70% of their day. This student has very low reading scores in DRA. The setting for this research was a Washington State school. As stated before, the students were in the general education classroom for at least 70% of the time. They did, however, go to the resource room for reading, including going to the resource room for this study. The students were pulled into the resource room at 1:35 in the afternoon to 2:05 for the study. This study was conducted by Sarah Morgan. However, she had the supervision and assistance of the other authors. There was a number of materials that were needed for this program. First of all, the students would need to have access to 24 high-interest stories that were at their reading levels. You need a CD player and the CD disc itself with the stories on it. You need headphones, a stopwatch so that you can conduct your fluency reports for WPMs. A student folder with the stories is also needed so students can follow along and read with the stories. You will need a graph so that students will be able to see their performance with their cold and hot reads. And you need a red and blue colored pencil. You need two different colored pencils because you will graph with the students their hot reads, which is a familiar reading, and that is done in red so that they can see how well they're doing with their familiar reads on their words per minute. And you also need a blue colored pencil for the cold reads, which is a story that has not been read by the student before. You will graph their progress with their cold reads with the student with that blue pencil. The target for this research is to increase fluency, their words per minute specifically, after a hot read, which, as I stated before, was a familiar read, a story that students have read many times. The design for this research was using miscue analysis to find the words per minute for cold reads and hot reads. The baseline was determined with the cold read of the same story for both students. It was graphed over 4 sessions for baseline 1 and then graphed over 1 session for baseline 2. Before conducting an intervention, the person conducting the study will need to find the words per minute goal for each student. This program actually recommends that each student's word per minute goal do not go lower than 80 words per minute, but because both students scored so lowly in their reading assessments and DRA assessments previously, student 1's goal was reduced to 55 words per minute and student 2's goal was reduced to 40 words per minute. After finding their goal, the students will work with the program. The program first introduces keywords and definitions. Then, the students will have a cold read, which is timed with a miscue analysis by the person conducting the study. After that, the student will continue reading this story with audio from the Read Naturally program. They will read it 2 different times with the program. Then, the students will read the story again independently without audio. Then the students will go back to reading it with audio, and after they read it with audio, they will read it independently. And at that point, students have to decide whether or not they feel that they are ready to do a hot read, which would be timed. If a student feels they are ready, that means that they think that they will be able to beat their words per minute goal. If that is the case, then the hot read is performed. If a student does not feel they are ready, they can read it a few more times with the audio and independently before having the hot read. If the student reaches their goal for words per minute, they are then asked 5 comprehension questions to make sure that they are understanding what they are reading. And then the person conducting the study will graph their words per minute with their first cold read and their hot reads with the student there. If a student does not reach their goal, then they repeat the process, rereading the story, and then they will try to make their goal again. The results of this study showed an increase of words per minute in both the cold reads and hot reads. Student 1 had a baseline of cold reads in the range of 24 to 36. After the Read Naturally program, the cold reads showed a range of 16 to 45. So even though the bottom part of the range got lower, they ended up having a higher score overall. The baselines for the hot reads for student 1 was 55 to 77. After using the Read Naturally program, the baseline After the Read Naturally program, the range increased from 67 to 72, and the average also increased. Student 2 had a baseline for cold reads of 14 to 25, and after the Read Naturally program, the baseline for the cold reads increased the average to 15 to 24. The baselines for the hot reads was 41 to 69, and after the Read Naturally program was 50 to 67. Some discussions that were had after this research was conducted. Both participants' scores in fluency increased. The Read Naturally program increased fluency scores. Students' confidence as readers, according to the teacher's observations, also increased. However, it is suggested that more research be done in cold reads due to some errors with the baselines. There would also need to be modified interventions for students if needed. The nice things about this program is it was not a time issue. They only took 30 minutes out of each day. The program is a cost-efficient program for schools to have.
There are many research questions that could be answered with the single subject research method. The area I chose to focus on is reading comprehension. There are different interventions teachers or researchers could use during a single session instead of over multiple sessions. The first question is descriptive and wants to know the effect that graphic organizers have. The question is, how frequently does an elementary student who uses graphic organizers show an improvement in his or her reading comprehension score? The second question is a comparison question. It compares how rereading a passage affects comprehension. The question is, how does an elementary student who rereads a passage of text compare to an elementary student who does not reread a passage of text in terms of his or her reading comprehension score? The third example is a relationship question. It asks about the relationship between using pre-reading strategies and a student's comprehension. It says, how does using pre-reading strategies relate to an elementary student's reading comprehension score? There are many questions that could be answered with the single subject research method.